More than 5 million teeth are knocked out every year. Can you believe it? But only 9% of adults in the U.S. know what to do if it happens. Following the right steps can actually save the tooth. So Dr. Stefan Zweig is here to talk about the importance of dental hygiene. Welcome, doctor.
Thank you.
So tell us why oral health care is so important.
Well, oral health care is very important because not only does it affect your mouth, but it affects your body in general. So we know that there are links between oral health or poor oral health and overall health and systemic disease. We know that we've done research and we know that there are links between oral health and disease like stroke, heart attack, diabetes, even oral cancer. So there are links that are being studied, and we're learning more and more all the time about how oral health affects general health.
Now, what should someone do if their tooth is knocked out?
Well, unfortunately, we're seeing more and more of this happening. There are about 5 million teeth a year knocked out in the United States. When your tooth is knocked out, the first thing you need to know is that time is of the essence. So the faster you can get the tooth back into your mouth, the better chance you have for survival of the tooth. You want to first find the tooth. You want to pick it up very carefully from the crown of the tooth, which is the white part of the tooth that actually shows in your mouth. You want to make sure the tooth is clean without touching the root of the tooth. So that might involve rinsing the tooth off with milk or water. And then you want to replace the tooth into the socket from which it came. And then you want to, after you've done that, you want to see a dentist as soon as possible, who will make sure that you put the tooth back in correctly and to stabilize the tooth if that's necessary. If you do these procedures, there's a good chance you can save your tooth.
What advice do you have for those people who are told that they need a root canal or a tooth extraction?
Well, the first thing to realize is that a root canal is a procedure that enables you to save your tooth. So that's opposed to having an extraction, which is complete removal of your tooth. Saving your tooth is actually preferable if you can do it. So if you're told you need a root canal, there's a good chance that the dentist that you're working with wants to save your tooth. So the first thing I would ask your dentist is that should you see an endodontist? Because an endodontist is a specialist in doing root canal. And many general dentists refer patients to endodontists to do root canals. If the doctor actually tells you that you should have your tooth extracted, you should ask them if there are any alternatives to save the tooth. And one of those alternatives might involve doing root canal.
Great information. Where can our viewers go to learn more?
Well, the American Association of Endodontists has a website. It's very simple. It's www.findmyendodontist.com. And on that website, you're going to find a lot of information about root canal. You're going to find out information about who endodontists are and what they do. And there's going to be a search engine whereby you can find an endodontist near you.
Dr. Stefan Zweig, thank you so much for your time this morning.
Thank you. Thanks for having me.
And we'll be right back.